Hey, deserving listeners. So recently I was on another podcast called Psychotherapy, Psycho/Therapy, hosted by Leah Denton. And the podcast is about when therapists harm their clients. And I want to just repurpose that interview on Psychotherapy with Leah Denton as an episode of my podcast because we got into some interesting areas. So let's just get to that interview now.
When I first began exploring conversations around therapy harm, I was struck by how few clinicians there were willing to speak openly and honestly about the realities of harm within their profession. You might expect ethical practitioners to be among the most eager to expose those who damage the field's reputation. But that is often very much not the case. Whether it's self-protection, a sense of loyalty to colleagues, a fear that admitting some therapists cause harm might stop people from seeking therapy, or even the assumption that if a client feels harmed, it's just a symptom of their mental illness. Whatever the reason, a lot of therapists prefer not to talk about the darker sides of their vocation. Dr. Kirk Honda is one of the exceptions. In addition to decades of experience as a psychotherapist and professor, Dr. Honda is the host of a popular podcast and YouTube series called Psychology in Seattle. He loves his work and he's passionate about growing the field of therapy by training new clinicians. But he will be the first to admit certain therapists fail to serve their clients' best interests, which is putting it very mildly. He's also willing to grapple with the fact that in far too many of those cases, the systems of oversight and accountability can seem more concerned with shielding practitioners instead of preventing further harm. Dr. Honda has built a reputation for believing that truly supporting therapy as a force for good means also being willing to look at the full picture, even the uncomfortable parts. He even started a Facebook group called Clients Harmed by Therapy in response to the many people coming to him to share their stories of therapy harm. And when that group struck a chord and started to grow exponentially, he took a step back and handed control over to moderators so it could be a safe and community-led forum. When you hear the stories I hear day after day, and when you have experienced what I myself have experienced, it can be hard to hold out hope, to believe that the world of therapy offers more healing than harm. But practitioners like Dr. Honda make it a little easier to keep that hope alive. And I'm grateful that he's my guest today.
I'm Leah Denton, and this is Psychotherapy, a show dedicated to providing survivors of therapy harm a platform to share their stories, and to offer language for those of us trying to make sense of our own experiences with the psycho in the therapist chair.
As we're wrapping up this season of psychotherapy, I wanted to take a step back and look at the broader landscape of therapy harm, and to talk about what steps the field can take to protect the people it aims to serve, especially those who are most vulnerable. I can't think of a better person to join me for this conversation than Dr. Kirk Honda. Dr. Honda has a PhD in psychology and a master's in marriage and family therapy. He's worked as a psychotherapist since 1996 and a professor since 1998. His podcast and YouTube channel, Psychology in Seattle, has amassed a following of hundreds of thousands, with episodes covering everything from deep clinical theory to pop culture.
So it's the mid-90s, and I'm trying to figure out what to do with the rest of my life. I was working in market research as a 24-year-old and saw my whole life sort of laid out before me, and I liked what I saw, but it didn't have the meaning or purpose that I was hoping for. And that's when being a therapist for the first time popped into my head. I'd been in therapy before, so maybe it planted a seed. And the realization or that career focus brought together so many different things. I remember marveling at how many things I had been interested in or participating in was very compatible or right down the middle of what it means to be a therapist, or at least what I thought. I'd been journaling since I was 13, and in that journal, had been talking a lot about my inner life and my experiences and my emotions and my relationships. And I just never really gave it much thought. I just really liked keeping a diary, essentially. And then when I thought about being a therapist, that was one of a couple dozen things in my life that said, oh, that probably means that I can fold together this and a lot of other interests in my life, a lot of other very meaningful aspects of my life. So that's what I did.
I imagine it's a lot to come out of school and suddenly be sitting with people in some of the most vulnerable parts of their lives. I mean, especially if you're young or don't have a whole lot of life experience yet. So for you, how long did it take before you started to feel competent in your work?
The thing that I was told was that it'll take 5 years to feel competent after graduation. I mean, it depends on what we mean by competent. If we're talking about it in the legal and ethical sense, I knew or was told that I was competent to practice under supervision for the first couple years after graduating. But I remember being told that I won't feel confident in my competency until 5 years later. And when I heard that, I thought, that's ridiculous. Why would you need that much time? And also, why would it be that specific? But there was a point later on in my career where I noticed that at the end of the day of working with a lot of clients, because in the beginning of your career, you tend to kind of be in the grind of many clients throughout the day, throughout the week, because it's all about productivity and whatnot. And so I suddenly realized that I was not beating myself up, and I hadn't had the thing that I experienced. And I remember noting this, is that it was a sine wave, sort of a lot of ups and downs, where there'd be moments where I would feel like I was the best therapist in the world. And there'd be moments where I just thought, I have no idea what I'm doing, and there's no evidence that I'm doing anything good for anybody. And then I remember I was driving in my car and I just thought, I haven't had that feeling of being worthless as a therapist in a while. It's been maybe a few weeks. Usually it was at least once a week. That's interesting. Oh yeah, I remember my professor saying it takes 5 years. That's funny. How long has it been? Exactly 5 years since I graduated. And that experience is almost universal, if not universal. I might even worry about a therapist who doesn't feel that way in the beginning of their career. It's too complicated to master this profession. At my stage, I'm 30 years in, and I am not perfect. I don't know everything. That's ridiculous to consider that. There's always room for growth on so many different fronts, not only just skill and knowledge, but also self-awareness and understanding of different cultural experiences. Of course, if I just assume that I'm more competent at 30 years than I was at 10 years, then you work your way back on the learning curve. And I wasn't as smart or as skilled or as flexible or as wise. And in 30 more years, if I manage to live that long, I'll presumably have more skills. So in terms of ethical competence, that is achieved in a formalized professional way. The training and the oversight and the scope of one's ability is, in terms of the ethical sense, is established early.
I'll often ask therapists how much they learned about therapy harm back when they were in school. And so far, the vast majority of them basically say almost never, or at least not beyond the basic CYA version, protecting yourself ethically so you don't get in trouble. I'm really curious about why there isn't more focus in training programs to protect clients from harm, or on how to work with someone who's been hurt by a previous therapist. Why do you think that is?
There's a lot of reasons why. One is that therapists, like I said, are generally insecure because the nature of our work makes it difficult to measure outcomes. If someone is an oncologist, they can look at imaging or blood tests or just look with their eyes and see that their surgery or their chemotherapy or their treatment resulted in a reduction or eradication of cancer cells, right? With therapists, there's nothing to look at, and it's a matter of opinion. There's even notions, credible, reliable, valid notions, that if a client claims that things have actually worked, it might actually be not true. They might just be saying that. They might be deluding themselves. They might be trying to please you. It's really hard to figure out if things are getting better. Plus, people have a lot of factors in their life, and they might come into therapy, and outside of therapy, things might be falling apart even more as time goes on. They might get worse. And is that because of therapy? Would they be even worse off with? It's just hard to measure. And so therapists, generally speaking, are walking around with a lot of insecurity. It's also an extremely difficult profession. I could go on and just about how impossibly vast and all-encompassing it is. What happens is you have students, trainees, and also professors who are walking around with this paranoia that they're not doing any good, that they might be harming people, and that a lawsuit and the therapy police will be knocking on their door any time now. The question or the topic of harm and the fact that that will happen is something they're walking around with anyway. It's sort of like how if someone had unprotected sex, for example, and they're worried about contracting an STI, depending on their ability to face things, they might actually avoid having a test because they don't want to know the answer. And it's a similar thing in therapy. For me, the more confidence and competence that I gained, the more able I was to just ask the question myself, have I harmed clients? But also just talk about it in general. It's sort of like if we talk about it, we acknowledge it, and we invite, even just in our own mind, scrutiny of ourselves. And if we can't answer that question, if we can't even answer the question, am I helping people? Then we also can't answer the question, am I harming people? It's terrifying. The solution is guidance and mentorship and awareness, something that you are doing, something that I am doing. And avoiding is not the answer. The other factor that I'll say is that I was a program director for a while at my university, meaning that I was the head boss of everything in the program. And the curriculum was to some extent up to me. And the balance between credits and tuition costs and time and the sheer amount of topics that you have to cover, some very crucial topics will not get covered just because you just do not have the luxury of the time. That doesn't excuse never talking about it, because it certainly should be brought up, at the very least in ethics class, but maybe sprinkled throughout. There's other reasons, but those are the ones I can start off with.
If clinicians felt safe saying, I've messed up in the past and I've let clients down, here's what I've learned about it, I feel like it would go a long way into making this topic less taboo. And I know that kind of self-reflection and honesty is hard for anyone, but are there any examples you can point to in your own career where you may have inadvertently harmed a client?
Absolutely. There's a moment that comes to mind. So I had a client who I was working with on a variety of things, and it was going well. Outcomes were good. And maybe a couple years into it, she opens up in a session and says, I finally feel ready to tell you about what I went through as a child. And this is perhaps every therapist's dream of creating a space so someone can feel safe enough to talk about the abuse that they went through, something that they haven't told anybody before. It's a common experience for therapists. It's the right place to do it. And she said that, and I just thought, oh, what do you want to tell me? I'm here for you. And she told me what she went through. It was trauma, sexual trauma as a child. I listened and I thought, wow, what a great testament of the work that the two of us have done, that she's arrived at this place. We have a lot of work to do from this place. I feel quite honored, very, very honored to be trusted in this way. She'd never told anyone before. And I was saddened by what I heard. I was angry at the abusers, but I was optimistic and feeling pretty good about how things were headed. And we made an appointment like normal when she left, and I never saw her again. I didn't know it was always a mystery. It's like, what happened? Of course, a couple of weeks after, when she wasn't responding to me, I really thought about the session. I was like, what's in there? Because I never heard what the exact reason was. But years later, I would learn much more about trauma and PTSD and exposure and habituation and triggering and all that neurology of that. And what I had learned was that at the time, before I had learned all that stuff, which was complicated because I'd have to look up research, I'd have to talk with mentors, I would receive supervision, I would talk with clients in the middle of supervision. What I had learned was that in the first 10 years of my career or so, I was operating from the common understanding of trauma and the common understanding of PTSD and the common understanding of talking about one's trauma in therapy or in any context, which was that it's inherently healing and safe to do so. I was not operating out of my own thoughts on this. I was following not only just what I was taught and what I was told, but also the culture in my field. What I had learned resulted in me concluding, I don't know for sure, obviously, but what likely had happened was she was operating on the assumption in our culture that it is universally always a good idea to disclose what she did. But what I should have done is slowed her down and said to expose yourself to the story by telling the story could create such a spike in trauma triggering that you could be harmed. You could even drop out of therapy because it's overwhelming. You could become suicidal. You could become highly distressed. You could dissociate. You could decompensate and neurologically be in a state of constant distress for the next month, because that happens sometimes, particularly with really difficult traumas, particularly if you've never talked about it before, because your body isn't acclimated to talking about it or to revisioning those events. And when I learned that, I looked back at this client and thought, that's probably what happened. And in terms of the stories of harm to clients, you classically think about having sex with a client or something like this. But I consider this to have been harm based on lack of competence. And if I had talked with other therapists and professors or mentors, people I looked up to, they would have supported what I did. That doesn't exonerate me, but it's weird. And when I have to instruct and supervise other therapists, it's this very strange action as a therapist that as a client, because clients don't know, and so they bring it up, or we as therapists see signs and we might ask a question, were you abused as a child? And the responsible thing to do, even 2 years into therapy, like I was with this woman, is to literally stop them in their tracks. Because we're taught to listen, particularly to stuff like this, and to let clients lead the session. We're not supposed to be draconian or directive, or especially we're not supposed to shut people down, right? But that's in a sense what you have to do. And I lay it all out to them, and it's kind of a long conversation of what PTSD is. And the thing is even if a client doesn't have PTSD and they're not going to be triggered by telling the story, usually I don't know. And so if there's a chance, even if it's a 20% chance of them telling a story that will lead to harm to them, that's enough reason to put the brakes on and to enter into a phase of trauma recovery that I have cobbled together myself that involves emotional awareness, emotional regulation, and also getting some sense of how much distress will occur if we start talking about those. There's certain ways of testing the boundaries of that. I have a system, and it's very tailored to every client, because every client's going to have a different awareness of their body, awareness of their emotions. It's so complicated. And by the time I had that session with that client, I had learned and read and absorbed and been supervised on trauma for years in a very robust way, but it lacked a particular angle to it, an important angle to it. Trauma and the neurology of trauma and its recovery is so complicated that it's hard to be competent especially right after graduation, and especially if you don't have a specialist who is supervising you. Anecdotally, I would say less than 10% of therapists who claim specialties in trauma understand this. If they say they specialize in trauma and one other thing, then there's a greater chance that they understand these things. But typically on a website or on a directory, there's like 30 things that they say that they work with, and trauma being one of them. Because of course, right? You're a therapist. Of course you work with trauma. You're actually potentially really looking forward to helping people with trauma. But like I said, the instruction is pretty bad and the supervision is pretty bad in this area. So to conclude the story, behind me is framed what one session she did. I had an in-home office, and so she was walking up to my house, and I had a Japanese maple out front, and she had gathered some leaves from my front yard that had fallen from the tree, and she had dried them and pressed them into a framed picture and gave it to me. And that is behind me, both as a visual reminder to me, but also it's in all of my content as well. That's video as a reminder or a token or a visual of some sort. It's this constant reminder of that I harmed a client.
Every survivor I've spoken to so far, myself included, went through something like this, where there was no real preparation before diving into trauma. And we all went on to experience much worse harm, but this was always part of it. None of us were prepared for the kind of chaos that unpacking trauma or being pushed to talk about it could create. And it's just one piece, but it seems to be part of every survivor's story. When my own therapist said he understood trauma and was quote unquote trauma informed, there wasn't a lot of clarity about what that actually meant. But a clinician's lack of skill or training around trauma doesn't necessarily mean that they're acting with malice. And I would even give my own harmful therapist a pass on this and say, when it comes to this piece of the puzzle, the harm he created was unintentional. But moving out of the realm of unintentional harm towards something more sinister, have you heard stories about other therapists that make you think, how in the world is this person still practicing? Or have you encountered students or interns where you feel like they should absolutely not be allowed to work with clients?
As a professor training therapists since just after graduation, so 29 years now, and with that responsibility comes gatekeeping and also doing what I can to prevent harm happening to the clients of my trainees. I've always felt tremendous responsibility for that. The notion of harm, and you get a bell curve of students, most of which you're confident in them moving forward, but some you have some questions about. And there have been some that I have personally gatekept and kicked out of the program and prevented from becoming a therapist. And that's its own headache. But I'm quite firm about that. In fact, in my program, I became the guy that talked about it and developed systems of formalized evaluation of students that might need to be gatekept. And I write about this in my book on supervision, actually. I consider gatekeeping to be one of the 19 roles that are core to being a supervisor. And there's different phases of gatekeeping. There's the beginning question of does this student need to be gatekept? Can this student be reformed and turned around? What's the bigger picture here? Because some people present with issues as a student that don't seemingly show up in the therapy office, and vice versa. The kinds of things off the top of my head from memory that I kicked people out of the program for, and there was almost always a lawsuit, by the way, which is a whole other pain in the ass, which is a reason why a lot of programs just avoid the whole thing. And also you have upper management that are often really interested in profit and sustaining the ability to pay one's bills and have no ethical responsibility or moral concern about releasing a harmful student into the world and will override me. I will be gatekeeping as a professional, as a clinician, as a program director, and I would have upper management at the university undermine me to the student and also just tell me that you can't do this. And it raises question as to whether or not upper management has that authority even, because I have another profession to answer to, which is the larger field of clinical work, which I'm also beholden to, and also just the moral thing. So the kinds of things that I would see would be harm to clients. There were students who would be complained about by a client, and we would look into it. Usually students past a certain point started to videotape all their sessions, and so we could actually review that. But before that, we would have to go off of descriptions. Getting back to your concern about therapists not believing clients who claim having been harmed before, there's the paranoia that I was talking about earlier of just like, well, if I allow for that idea, then I wonder if I've harmed clients, and I just don't even want to go there. But there are other factors as well, is that if clients complaining about past therapy is brought up at all, it's often brought up in the context of borderline personality. And also the way that borderline personality is talked about is in this really extreme, ignorant, uninformed, cartoonish way that talks about maybe one profile of someone with borderline, but certainly not everyone, as a semi-delusional, constantly butthurt client who sues everybody and is semi-delusional about everyone in their life, particularly the therapists that they work with. I remember hearing, well, borderline clients, they sue all of their therapists. And so that's the only time you're going to hear about it. And it's supposed to be discounted. Maybe even you don't even want to work with a client like that. There's a possibility that when they heard that you had a complaint about a past therapist, they immediately wondered, or maybe even concluded, that you were semi-delusional, that you're borderline, and that they're next. And so they get terrified. They start to clam up. If they agree with you, are they pre-agreeing to you attacking them? What if this person is an acquaintance of theirs and they don't want to hurt anyone's feelings? Are they going to get called into court? Because anecdotally, therapists don't really understand the legal landscape of how to handle situations like that. Yeah.
I bristle a little bit when I hear the borderline diagnosis wielded. I had actually never even heard of borderline until I started talking to survivors. And to date, I have yet to meet someone who dared file a complaint that wasn't retroactively labeled BPD by their therapist, even though that diagnosis never came up during their sessions. And it does seem like the board actively looks for reasons to believe the therapist over the client. And borderline is that magic word they look for.
There's not a lot of situations, maybe in police brutality situations, where you not only have the system that prefers one side or the other, but you also have a very robust professional on one side and a layperson on the other side. The therapist has that authority to diagnose and to conclude. Then that can just be used as a weapon to just completely discount everything that a client says in a complaint. You could literally claim that they're delusional. And if you believe that as a therapist or you make it up, how do you figure out if you're a trier of fact, if you're a board or a court or a judge or a jury, how do you know if the client isn't delusional and wasn't delusional? All you have to do as a therapist is say, that didn't happen. She's making it up. How do you as a client prove to people outside of that it did happen? And the clinician is more likely to present in a more believable, authoritative way because they have a lot of education and have the ability to articulate themselves typically. Also, there's malpractice insurance, which we all are required to have, which is ready to go in these situations by paying a lot of money for legal defense. Whereas a complaining client going to the board or to the courts, they have to come up with this money themselves. And there's also not a lot of money in suing therapists because the settlements aren't typically large. It's not like the medical malpractice field where you could get millions. In therapy, you might be looking at $10,000, $20,000 or something. And so there's not as much of an incentive, and certainly not as much of an incentive for a lawyer to take it on with the contract of gaining a percentage of the settlement,
So much about this never fails to astonish me. For many clients, the legal route wasn't even their first choice. It's where they end up after everything else fails. And from what I can gather, most really just wanted an apology or some sort of acknowledgement of the harm that was done. And when that doesn't happen, they turn to the licensing board, hoping for validation there. And as I've seen too many times, the board often does nothing. And when that system fails too, legal action becomes the only option left. But ultimately, the number of repeat offenders who are allowed to keep practicing after what amounts to little more than a slap on the wrist in most cases is horrifying.
I've been upset about it for decades. It seems to be every board, even boards in Canada. It's just anecdotal, but when every anecdote plays itself out this way, where, yeah, they might do something, but it's almost always short of the mark for me, far short. There are cases where it's pretty clear the individual lacks judgment and insight in general as a clinician, maybe even as a human being. I'm not talking about someone that becomes a friend with a client after termination or something like that. I'm talking about people that have 10 egregious, somewhat unrelated violations, and they're at worst given the sentence of a suspended license and a fine of $2,000. They get their license back after a year, maybe even after just a couple months, maybe not even at all. Maybe they're just put on probation where they have to have a supervisor and they get to choose the supervisor. And I'm always thinking, if you are complained about to the point where it is, because most complaints, they don't even get investigated because the boards don't deem them to be valid enough, which is fine. There are a lot of silly complaints. I've had someone complain on my license because I'm guessing someone online that hated me, and they complained because I was calling myself Dr. Kirk and I wasn't a physician. And I will go into detail on just how stupid that is, but that was basically all that was in the complaint. But in terms of the ones that do get investigated, the vast majority are dismissed. So if you're that provably horrible, or you committed that violation, one, what's the chance that those are the only violations they've ever committed? Two, even with that client, it probably doesn't even encapsulate all the harm that happened. Three, we don't have enough therapists in the world, but society doesn't want that person practicing anymore. I would like to think that other therapists wouldn't want someone like that representing the field. I just don't understand why it's just so hard for the boards to be harsher. Because the thing is the therapists, particularly the ones that have multiple violations, are so different from the typical therapist. Most of the people that I know, particularly novice therapists, are so paranoid about ethical violations that one of the things that we talk about in ethics is we're not supposed to accept gifts from clients. That's a simplistic way of saying it. There's nuance to it, but if you don't understand the nuance or you're worried about where that line is, you just say, I can't accept gifts. Then you have a client who is maybe from another culture, who maybe isn't even paying for therapy because welfare is paying for the therapy. And they just really want to give you something like a card or a plant, or maybe they made something in ceramics or something. They just want to give it to you as a token. And I'll have supervisees who will accept it in the moment because it just feels so wrong not to accept it. And then they come into supervision and they're like, I'm so worried I'm going to lose my license and you're going to kick me out of the program because I did something yesterday and I don't know what to do. And I'll be like, oh my God, what the hell did they do? And they tell me the situation. I'm like, that's fine. One, that's fine. Two, it might even be unethical not to have accepted that because the client could really be hurt by that. Three, let's talk about the reason we have that rule. It's not really at play here. So most therapists are over paranoid about ethical violations. And then we have these very few that have something in all likelihood characterologically wrong with them and commit all these violations. there's a lot of careers in the world, right? There's a lot of jobs one can have. And clearly being a clinician is not for you.
Right. There's a big difference between a clinician who inadvertently harms a client, learns from it, and moves forward, versus someone who seems either unwilling or incapable to learn from their mistakes, and so continues to harm people again and again. And maybe they even show signs of predatory or abusive behavior. As a supervisor, have you noticed any consistent traits or behaviors in therapists who end up causing repeated or even more serious harm?
My malpractice will send these case briefs of clinicians who have been successfully sued. They have committed an ethical violation. And so it's a very general description, and they don't go into personality. But I have worked personally and professionally in person with these kinds of cases, and thus have more information about the personality of the clinician from various different sources, from interacting with them, from subpoenaed records of their therapist, if the violating therapist is in therapy themselves, with more descriptions of the violation itself. And I'll tell you, a lot of the time, the therapist has something fundamentally off about their personality and character, whether it's narcissism or borderline or histrionic or antisocial psychopathy. That happens. Now, it's not always the case, and it's hard to know because I'm looking at it through a particular lens with a particular bias, perhaps. But it certainly looks that way, especially when I would work with people ongoing. I'm thinking of one clinician who, I won't go into detail, obviously, for obvious reasons, but she had committed a very egregious, ongoing romantic sexual relationship with a client. She was complained about. She was fully outed. She was prosecuted, board hearings, legal trouble for years. Then, after the dust settles, she is saying things like, well, so I have this other client and I kind of feel like we're connecting or something like this, and started going down that road again. Or what happened before, I don't know. I feel like that whole thing was just one big overreaction. I mean, what's the big deal? And I'm like, okay, clearly there's a perceptual problem here. There's something wrong with this person, right? It's not just that they were uninformed or their life wasn't going well at the time, which can be a big factor, or they just lacked consultation or outside influence. This person, I don't know exactly, but you have to have a very distorted perceptual system to go through all of that for years and to be prosecuted and sentenced and sanctioned, and all that time to self-reflect, at the very least, at the notion of having a relationship with a client, and then to justify and to start to go down that road again. So obviously there's something wrong with the person.
You've mentioned on your show that even clinicians with personality disorders can still be effective and really advocate for their clients. But I've heard stories from a number of survivors who feel like their harmful therapist presented with tendencies of narcissistic personality disorder. What sorts of structures are there, or do you encourage for clinicians with any kind of diagnosis like that?
Well, first off, I would question any former client's conclusion about narcissism because research shows that even a fair amount, if not most, clinicians don't understand narcissism and how to evaluate it. So that's first off. The second thing is, when it comes to a personality disorder, it depends on a lot of factors in terms of whether or not a therapist with a personality disorder would be at risk of harming a client. One is the degree, the point on the spectrum that they are. Two is the amount of therapy that they've been through in general, but also in relation to that personality disorder. And three, the amount of insight they have about how it affects them when they're under stress or their triggers or whatever, how those schemas and that disorder can be enacted. And four is their management system. So I've had students that came to me at the very beginning of the program saying that they have a personality disorder and have recovered quite a bit. And so that's a different scenario than someone that doesn't even know they have a personality disorder, right? And the stigma and the notion out there that if someone has a personality disorder like narcissistic personality disorder, then they're automatically a monster is just not true.
That's a fair point. And just like BPD shouldn't be used as a boogeyman to discredit survivors, not every harmful clinician out there qualifies as having narcissism. Taking a step back and looking at the field of therapy as a whole, though, from the first day of class to retirement, it seems like there's so many different changes that could be made to help protect clients. What are some of the changes you'd be most eager to see?
More talk in graduate school, obviously, as you were advocating for before, more willingness for therapists to accept that this is happening and that they might have harmed clients themselves. That's why I like to model that I can talk about moments in which I have harmed clients. After a certain point of one's career, especially if you work with the kind of clients that I do, it's going to happen. It just depends on what you mean by harm and whether or not it is a legal thing or an ethical violation of any sort. The other thing would be just more awareness, more talk about it, which is what I'm trying to advocate for you as well. Along those lines, the licensing board, there's no public outcry about this, and there's no professional outrage, or not enough anyway, about this for various different factors that I've been over and others. Apparently, what that results in, I don't know what's going through the members of the licensing board, but the way it seems is they're either bored, lazy, or self-interested because they don't want to implicate the profession, or they don't know what the public wants. Because, one of the ideas that opposes boards taking more severe actions against a known violator is that there's a notion out there, which I can agree with, is we don't want to take a clinician out of the community because there's not enough clinicians in the community. I think they overemphasize that and not emphasize enough the other factors. Plus, if they do take action against the therapist can sue them. And the therapist has privilege and education and money to do so. So protections need to be given to board members. You can't sue a jury or a judge, you know what I mean? And maybe there's some nuance around the law around that. You also have board members that aren't given enough time. They're not given enough funds. These are often volunteers from the field or from the community that are just volunteering their time. And if it's not your job and there's not a lot of incentive to make your life more difficult by looking into a case or investigating it or something, then I think people default to not doing enough. I think there should be federal level, not government necessarily, but an understanding in our field about if there's this sort of violation, then this is generally what should be done. There really isn't that kind of thinking out there. There's an assumption, like if you have sex with a client, for example, there's an assumption that you'll never work again as a therapist, but that is not necessarily true. I wish I could talk to some of these boards. I generally think that people are trying to do a good job. So the only thing I can think of is just that they aren't given enough time, and there's not enough oversight, and there's not enough public interest for these people to really pay attention. Meanwhile, you have a bunch of clients that are walking around being harmed. The other thing is that the harm that happens in therapy, you can't see. If a contractor screws up a bathroom renovation, you can tell when the water is leaking out of the wall. But when you harm a client, it's all just description and non-visual. And of course, the patriarchy doesn't want to acknowledge emotions in general, let alone this sort of thing. So I could ramble about this for a long time.
Before we close, is there anything else you'd like to add? Also, where can we point people if they want to hear more about your work?
Where you can find me is on YouTube and on your podcast app. Psychology in Seattle is the name of the podcast and YouTube channel. the best solution to someone having been harmed by a therapist is to find another therapist. Yeah, that's often the irony is why in the world would a former client having been harmed by a therapist seek therapy? And how would that person even know? Even if they did conclude, yes, I do need therapy, how do you vet whether or not a therapist won't be that way again, right? More information needs to be out there, and therapists need to have ways of articulating this. And when you have a license to practice in your jurisdiction, it should indicate something. It should indicate that you have not committed any major violations in your past. At the very least, that would rise to the level of someone complaining and you being sanctioned. But you can be fully licensed and having committed multiple horrendous violations in the past. Now, those are often a matter of record, but who knows how to find those things, but that's out there.
I want to thank Dr. Honda again for joining us for this conversation. If more clinicians grow a willingness to confront hard truths and grapple with the reality and nuance of harm in their profession, then maybe the prevalence of therapy harm and the gross inaction in its wake won't be the end of the story. I'd like to thank our audience for joining us this week. We hope you'll follow the show and tune in again next time. A big thank you to our writer, Leah Denton, and to our audio engineers at Peachtree Sound.